You might have seen medical dramas where doctors accidentally leave surgical tools or other objects inside patients. It's a terrifying thought, but unfortunately it happens more often than you might think. In fact, there are over 1,000 cases of these botched procedures every year. But what about a deliberate act to sabotage your life and leave you deeply traumatized? Liana Gedz's experience was a particularly harrowing reminder of the devastating consequences that can arise from such medical errors. Liana Gedz had mixed feelings about the birth of her child that fateful day in 1999. Nevertheless, she was set to welcome her baby via a planned C-section. But what was supposed to be a joyful moment turned into a nightmare that left her husband speechless. Her surgeon, who was supposed to be a trusted doctor and close family friend, had left a gruesome and everlasting scar on her body. A scar that would forever serve as a symbol of betrayal and grief. But it didn't end there, because despite the unforgivable event, the surgeon remained unremorseful and exhibited a very nonchalant attitude towards the matter. Worse still, he moved on to secure a position in another hospital amidst rising tensions and unsettled scores. His continued practice and unrevoked license made him a serious threat to the medical profession, constituting more risk to thousands of patients that came to him on a daily basis. But like most tragic cases involving doctors and their patients, this was never the result Liana hoped for when she was taken into the OR by her surgeon early that morning, though she left the hospital afterwards, cradling a bundle of joy that she had hoped and prayed for so many years. Yet, her life would forever be altered in ways she never imagined. The 30-year-old Dr. Liana Gedz, a dentist, and her husband, Dr. Robert Galili, an oral surgeon, were deeply in love. They had a blooming relationship that wound into marriage just after a year of seeing each other. Both doctors had met at a dentist conference in New York in 1996. In the midst of the conference, sitting quite close to each other, they had sensed a burgeoning feeling of attraction between them. It was what you would call love at first sight. After the conference, it didn't take long for both admirers to find themselves in the company of each other. They would spend hours on end talking about future goals, dreams, aspirations, and couldn't help but notice how each of their plans seemed to align together. She was a great dentist and was loved by her patients and everyone she came across.
I've been a patient with Dr. Gedz for over a year now, and she's super supportive and realistic. I feel like my teeth are in great hands, and I kind of look forward to coming back to the dentist, which is the first.
But what these lovers couldn't foresee or envisage was the storm that was brewing at the edge of their union. Just a year after they had met, they tied the knot in 1997. A happy time for both of them, you might imagine. But this would be the beginning of a tumultuous marriage, plagued by rather natural challenges. Trouble started when the couple was expecting their first pregnancy, which had unfortunately ended in a stillbirth in May 1998. Liana was distraught. After the delivery, she always cradled the remains of what could have been the early answer to her lifelong prayer. She had always dreaded miscarriages, yet here she was, dealing with what a lot of individuals thought more devastating than miscarriage, stillbirths. Because of that, she plunged into severe depression, agony, and plight. It was at this time that a friend introduced the couple to Dr. Alan Zarkin, a renowned Manhattan obstetrician, and they wasted no time in scheduling a meeting. Doctors, according to many, often radiate a sense of warmth and optimism, and Dr. Zarkin was no different. On meeting him, he seemed more than confident in his years of experience and expertise, so he pledged to help the couple move past the loss of their first pregnancy and the consequential strain it had on their marriage. He assured them that not only would they have a safe pregnancy, but they'd also welcome a healthy baby. It seemed like a fresh start. Liana took in again under his watch. Now her dream of becoming a mother was beginning to look possible, or so she thought. She would be nursing her child soon enough. It felt like a dream come true. But just like a mist that falls in the morning, her newfound joy soon disappeared with the advent of another devastating miscarriage. The extent of her pain was indescribable. However, despite this setback and utter bewilderment, Dr. Zarkin kept up the support and reassurance. He was always there with comforting words, reassuring them that it was just a temporary setback. His involvement went beyond medical advice, as he even offered guidance on the best approach to lovemaking, so that they could have a hassle-free conception. All these acts endeared him to Liana and her husband. They trusted him completely, because he was now a close confidant, and a figure who had seamlessly woven his way into their hearts and home. Perhaps it was the man's agreeable demeanor that caused Liana's husband, Robert, to completely entrust the medical well-being of her family into his hands. This doctor had become more than a recommendation to them. He had become a family friend and a medical confidant. He had become their family doctor. So Robert thought it wise to improve on their relationship with the doctor and further invite him into their lives. Because after all, it takes only a meeting to get to know someone, and just a few more to begin trusting them. But trust is a volatile currency, one that should never be handed over so easily, especially to someone like Zarkin. Though renowned in his field, they barely knew the man behind the confident smile. If only they had realized sooner, they might never have left Liana in the hands of a stranger whose true background they barely knew. However, soon afterwards, Liana got pregnant for the third time and received an extensive prenatal care from Dr. Zarkin. This would have been her third child if the first two pregnancies had gone as planned. However, there was a noticeable sense of disappointment in her demeanor. But then she recognized the need to show gratitude for yet another chance at conception, and knew better not to brood over what was past. So she decided to channel that energy into ensuring the smooth carriage and delivery of the present one. The doctor-patient relationship they had flourished, and their friendship grew even stronger. Liana and her husband would often invite him to share personal moments with them, being colleagues in the medical field. It was then he became a regular at family gatherings outside the hospital and at summer camps in their Long Island home in East Northport. There was a looming chaos in the air Liana could feel. This was not about the doctor, rather it was about the likelihood of not being able to carry the pregnancy to full term too. This was a numbing feeling in her guts that she could not, or would rather not, share with her husband or Dr. Zarkin because she thought she would be reprimanded. In 1999, just like she had feared, Liana began to notice some strange signs in her pregnancy. But this time, her husband noticed it too. Liana was going through the later stages of her pregnancy, filled with trepidation as she began experiencing alarming complications. The symptoms were all too familiar because they reminded her of her past trauma, and for fear of further complications that could lead to something worse, she was immediately moved and admitted into Beth Israel Medical Center Hospital in New York City, where their favorite doctor, Dr. Zarkin, practiced as a surgeon. She was only 7 months along, and the urgency of her situation was palpable. Doctors immediately placed her on strict bed rest, and the days turned into weeks as she lay in the hospital, her hope laced with fear. But little did they know that this would be the start of an unexpected string of events made more deplorable by the havoc the surgeon would orchestrate on the innocent young wife of his friend. On account of her near pregnancy complications, Liana was faced with the biting reality of premature labor. This would mean, instead of the usual 9-month birth cycle, she would have to deliver the baby earlier than planned. It was either that or standing the risk of getting another miscarriage. This was too much to bear on the 30-year-old. 2 failed pregnancies did a toll on her in the worst possible way, and she was not ready to have another. So she had to remain at the hospital for the next 2 months to be properly watched and observed by Dr. Zarkin. As the weeks stretched on, her world became confined to the sterile walls of her hospital room. Monitors beeped rhythmically, tracking her vital signs and those of her unborn daughter. Each day was a mix of hope and anxiety, and the walls of her hospital room felt like they were closing in. The last days of her pregnancy were bleak and uncomfortable days, and she would often look through the windows of her hospital room, hoping that things would change. She would wonder what her life had and would become like, how her pregnancy was going to turn out, and how much longer she'd have to remain in the hospital bed because of the pains. However, one thing she was certain of was that this wasn't the life she had envisioned for herself, for her husband, nor for her future. In the long, monotonous days that followed her stay in the hospital, she was not lacking in love and care from those around. Her husband, Robert, sometimes would suspend his busy schedule to come stay with her, and most of all, the friendly and always optimistic presence of Dr. Zarkin hovered like a raincoat in the storm. To them, he was there to offer medical assistance, emotional and mental support. But underneath his smooth and caring demeanor was a side of Dr. Zarkin that Liana and her husband didn't know of. A side that would reveal the extent of carnage he was capable of unleashing on the innocent family. A side that would totally betray the trust they had in him, scarring their lives in unimaginable ways. For Liana, the journey to motherhood had always been a cherished dream, a fragile hope that glimmered through the pain of past losses. After her miscarriages that left deep scars on her soul, she had learned to tread carefully around the delicate nature of her hopes. Yet, despite the trauma, she and her husband Robert remained cautiously optimistic. By early September, the tension reached a breaking point, and despite the best efforts of her medical team, Liana's body was giving in to the inevitable. Labor could no longer be postponed. On September 7th, an emergency cesarean section was scheduled, a procedure that would bring her daughter into the world 6 weeks early. It was a moment she had longed for, yet the circumstances felt overwhelmingly precarious. On that fateful morning, Liana was wheeled into the operating room. For Dr. Zarkin, this was just another day at work. He had delivered countless babies, and each procedure was supposed to adhere to the highest medical standards. Yet, as Liana lay on the operating table, sedated and vulnerable, no one could anticipate the dark turn the day would take. At approximately 11:30 a.m., the procedure began. Dr. Zarkin made the first incision, and the surgical team moved efficiently, focused on delivering Liana's baby. After what felt like an eternity, her daughter Emma Galili was born. Weighing only 4 pounds and 11 ounces, she was fragile but alive. That moment brought immense relief and joy, especially for Liana and Robert, who had fought so hard to reach this point. But as Liana lay unconscious, Dr. Zarkin, in a shocking display of ego and disregard for ethical standards, took a scalpel and carved his initials AZ into Liana's abdomen. These initials were not small or subtle. They were emblazoned on her body, 3 inches high and 1.5 inches wide. Witnesses later recounted the horror of that moment. The OR became a scene of grotesque violation. Nurses and medical staff stood by in stunned silence as Zarkin inscribed his initials into the unconscious woman's body. The question was, how did trained medical professionals allow this to happen, and how could they have witnessed such an act and failed to intervene? Nobody knows. When Liana finally woke up from the surgery and anesthesia, she was in excruciating pain, but this was expected after a major surgery. However, she quickly noticed something felt amiss. There was a sharper, more localized pain that didn't align with her expectations of recovery. The nurses who entered her room seemed oddly eager to check on her. Their quick, nervous glances were hard to ignore, and there was something unsettling about the way they acted. They seemed to be expecting something, though no one said anything out loud. Liana wondered what was wrong, because the looks on their faces were confusing. She wondered why they were acting so strangely. Their evasive behavior only heightened her anxiety, and when no one provided answers, she felt an overwhelming sense of dread. 2 days passed, and her concerns only grew. It wasn't until September 9th when Dr. Zarkin entered her room, accompanied by Dr. Daniel Saltzman, the chairman of obstetrics, that her worst fears were confirmed. Dr. Saltzman walked up to her, looking a bit uneasy, and that only meant that something had happened during the surgery. Frustrated and demanding answers, she insisted on a mirror. When she looked into it, her heart sank. There, etched into her swollen abdomen, were the letters AZ, a visible mark of a very deep betrayal. Liana was mortified. It was as if a part of her soul had been ripped away. She later described the feeling as akin to being raped, saying that she felt like a branded animal. To her, the scar was a physical and emotional wound that would take years to heal. And for her, the betrayal ran deep and left her feeling stripped of her autonomy, her dignity, and her trust. How could someone she had trusted, someone who had been a part of her family, inflict such a violation? Because of that, she felt an overwhelming sense of shame and an embarrassment so profound that she could not even undress in front of her husband. But as the dust began to settle on Liana's horrifying experience, it became clear that Dr. Zarkin's behavior was not an isolated incident. Investigations into his past revealed a troubling pattern of inappropriate conduct and negligence that spanned several years. Reports indicated that prior to Liana's case, Zarkin had faced multiple complaints regarding his behavior. There were accusations of him making lewd comments to patients, engaging in unprofessional conduct with staff members and patients during examinations. One former patient recounted feeling uncomfortable during her visits, describing Zarkin's increasingly crass remarks over 3 years, which ultimately led her to file a complaint with the state. In one instance, she reported that Zarkin had made crass sexual jokes and told her he was taking Viagra 3 times a day and jerking off in the bathroom. This left her feeling deeply unsettled. Despite these warning signs, Zarkin continued to work unimpeded. Additionally, Zarkin had previously practiced at Murray Hill Obgyn Associates, where his inappropriate conduct had also raised eyebrows. Liana's case would not be the first time his actions had raised eyebrows. However, the hospital administration had repeatedly failed to act on these complaints. Instead of addressing the issues, they allowed him to continue practicing medicine and enabling his reckless behavior. The New York Post reported on his previous indiscretions, detailing several complaints about his lack of professionalism and potential violations of patient trust. While these concerns had been documented, they were often brushed aside, treated as mere whispers in the bustling corridors of the hospital. This negligence ultimately set the stage for the catastrophic events that would unfold during Liana's surgery. What compounded the horror of Liana's experience was the knowledge that Zarkin had a history of behavioral issues, and yet he was still entrusted with her care. So it became evident that the hospital had prioritized its reputation over patient safety, because despite being aware of his troubling past, they had failed to intervene and placed vulnerable patients at risk. As the reality of her situation set in, Liana was emotional and very angry because no one had intervened, and because everyone in that operating room had a responsibility to protect her, yet they had all failed. The psychological toll of this realization was immense, because for many days she wrestled with feelings of shame, anger, and confusion. She was a new mother, filled with love for her baby, yet she was overshadowed by a horror that was difficult to describe. The consequences of that day haunted her long after she left the hospital. At the core of Liana's struggle were the scars left behind. not just the visible ones on her abdomen, but the invisible wounds etched deeply into her psyche. The PTSD symptoms began manifesting soon after the incident. Liana experienced flashbacks and nightmares that thrust her back into the operating room, where she was unable to escape the memory of that horrifying moment when she woke to discover Zarkin had carved his initials into her skin. The sight of the letters AZ on her abdomen was simply horrifying. Simple activities like getting dressed or taking a shower became fraught with panic. Even the mere act of undressing in front of her husband turned into an emotional hurdle. She was reluctant to reveal the scar to him, feeling ashamed of what had happened and the marks left on her body. The intimacy they once shared became overshadowed by her feelings of self-consciousness and shame. In the days following the incident, Liana became increasingly isolated. Friends and family had offered support, but she often struggled to articulate her pain and trauma. The emotional weight was compounded by the physical pain associated with her recovery from the C-section and the infection that developed around the scar. This eventually led her to depression. However, she wasn't going to let him ruin her life and her babies. So, she decided to reclaim her life. She sought therapy. The process was daunting, but really rewarding for her. With the help of her therapist, she began to unravel the ugly layers of her trauma, including feelings of betrayal and loss. While progress was often slow, she experienced significant breakthroughs. Learning to express her emotions and articulate her feelings of violation allowed her to confront her trauma head-on, yet there were also setbacks. Liana faced days where the weight of her experience felt unbearable, and the cycle of despair would threaten to pull her back down into darkness. Despite these challenges, Liana exhibited noticeable resilience. She began to channel her experiences into advocacy work, using her voice to raise awareness about medical malpractice and the importance of patient rights. This newfound purpose gave her strength and a sense of empowerment that had long been absent from her life. By sharing her story, Liana sought to break the silence surrounding such traumatic experiences, helping others understand that they are not alone. Liana's therapeutic journey was marked by significant moments of personal growth and resilience. With each session, she peeled back layers of her trauma, confronting the uncomfortable truths of her experience. Her therapist employed a variety of approaches, including cognitive behavioral therapy, CBT, and exposure therapy, which helped Liana gradually confront her fears and anxieties. Over time, she began to reclaim her body. Through guided visualization exercises, Liana learned to separate her identity from the scars that marked her abdomen. In these moments, she learned to see herself as more than just a victim. She was a survivor with a powerful story to tell. As Liana's self-acceptance grew, so did her determination to advocate for others who had faced similar violations in the medical field. In therapy, she found tools to cope with her PTSD symptoms. Mindfulness practices, grounding techniques, and breathing exercises became essential parts of her toolkit for managing anxiety. She began attending support groups for trauma survivors, where she found solace in connecting with others who had faced medical malpractice. Hearing their stories helped Liana recognize that her pain was not isolated, it was part of a larger narrative of systemic failures within the healthcare system. During her recovery, she struggled to find peace, and in the weeks that followed, was faced with a very agonizing decision about her physical appearance. She could either live with the demeaning scar or undergo painful and extensive reconstructive surgery to remove it. Each option carried its own weight of trauma, and the pressure felt overwhelming. Ultimately, she chose to undergo surgery. This decision was an important moment in her healing journey, a reclaiming of her body, autonomy, and a powerful step towards self-acceptance. She later became an advocate for mental health awareness and patient rights, using her story to illuminate the often hidden consequences of medical malpractice. However, the fallout from Dr. Zarkin's actions extended beyond the walls of the hospital where he had violated Liana's trust. Following the incident, Beth Israel Medical Center suspended him from his position, and he subsequently resigned. But the swift response from the hospital raised questions about their accountability, given that Zarkin had a documented history of inappropriate behavior with patients and staff. At the age of 61, Zarkin had been practicing medicine for over 13 years when he committed his terrible act. During a hearing, when the judge, Justice White, asked him what he had done, Zarkin replied in a calm, steady voice that he had used a scalpel to scratch his initials into her. His stark admission left many in the courtroom stunned. Following the incident, Zarkin's actions were heavily scrutinized, and Liana filed a civil lawsuit against him, seeking $5 million damages for the emotional and physical suffering he had caused her. The legal proceedings were complicated by Zarkin's defense team, who attempted to attribute his actions to a rare neurological disorder known as Pick's disease, which, according to him, was similar to Alzheimer's. This condition, a form of frontotemporal dementia, affects impulse control and behavior, leading his attorneys to argue that Zarkin was not fully aware of his actions during the surgery. However, prosecutors rejected this defense, emphasizing the intentionality of his actions and the heinous nature of the crime. While Zarkin received probation instead of prison time, the public was furious. He was sentenced to 5 years of probation and was ordered to pay Liana $1.75 million in damages, but no jail time meant he could potentially practice medicine again. Had he been convicted, he would have faced up to 25 years in prison, which was a big contrast to the reality of his slap-on-the-wrist sentence. This situation raised significant concerns about patient safety, as Zarkin was effectively allowed to continue his career after such a grave violation. In a surprising turn of events, Zarkin eventually secured a position at Choices Women's Medical Center, a facility providing abortion services, shortly after his resignation from Beth Israel. However, it didn't take long for the clinic to catch wind of his past misconduct. Staff members and patients expressed concerns about Zarkin's history, and that led to his dismissal. Witnesses reported incidents that mirrored past complaints, including inappropriate remarks and behavior, which ultimately prompted the clinic's administration to sever ties with him. Meanwhile, Liana's journey was just beginning. While the financial settlement provided her with some security, it could not erase the emotional and psychological trauma she endured. Liana continued her therapy, committed to healing and reclaiming her identity. She found strength in her advocacy work, channeling her experiences into a mission of raising awareness about medical malpractice and patient rights. However, the very alarming details of this medical mishap, betrayal, and havoc is an experience Liana and her husband may never have fully recovered from. Want to learn more about shocking medical cases like this? Like this video, subscribe, and hit the notification bell to stay updated on the latest stories that will leave you speechless.